But joining me right now is South Dakota Republican Senator John Thune, who is chair of the Republican Policy Committee. Senator Thune, it is very good to have you with us. Good morning to you.
Good morning, Martha.
You know, I think a lot of people watch everybody getting on these buses and they say, this is a done deal. I mean, this is reality. What do you say?
It is a done deal in the sense that the Senate-passed bill is now going to the president to be signed, but they made all these promises to House members to get them to vote for that bill, and all those changes now are going to be before the Senate this week. And so what we're going to try and do in the Senate this week, Martha, is keep from getting this really bad bill even worse. And there are lots of things in the reconciliation bill that we think need to be defeated, including also now a takeover of the student loan program, which hasn't been all that well covered because the focus has been on health care. But the taxes are higher. The increases in taxes are even higher in this reconciliation bill. The Medicare cuts are deeper. There are lots of things that we think make us committed to trying to defeat this bill.
You know, I understand that your argument was really in play for all of this before those Democrats agreed to sign this bill in the first place, because you had a lot of leverage when you could say to them, look, if you sign this bill, you're never going to get the fixes that you think are going to be part of this package. But now that moment is passed. That bill is signed. And where is your leverage to really change anything with the votes and the numbers that you have in the Senate right now?
Well, I think you could make the same argument for the Democrats. What incentive do they have now that this bill has been signed into law? A lot of these commitments were commitments they made to House members to get them to vote for it. But we think if we can change this bill in the Senate, if we can raise points of order, if we can amend it, there are amendments that we'll offer that address the fundamental flaws in the bill, which is higher premiums, higher taxes, Medicare cuts, and in the end, piling more and more onto the debt that our children and grandchildren are going to have to pay. Those are things that we will try in this bill to modify and send it back to the House. You are correct that the bill that the president's now signing into law puts a lot of the changes into effect, but we will start a different campaign on that point to try and repeal that and replace it with legislation that makes more sense, and you'll see that underway as well. But the reconciliation bill before the Senate this week is bad, and we're going to try and fix it.
All right, and we're going to be watching that very closely. I want to turn a little bit to politics now, and I want to play a piece of sound. This is Nancy Pelosi speaking with ABC, and I want to play this for you. She was responding, I should set this up properly, she was responding to a question about John Boehner saying, shame on you, to Nancy Pelosi. And here's what she said.
You know, some people will do anything for the insurance companies.
I think that's the minority leader's motive.
Yes.
Is that John?
Yes, I do.
His entire motive.
Well, I think his motive is that there will not be an expansion of health care for all Americans with a government involvement in regulating the insurance companies.
All right, so Nancy Pelosi claimed in that interview that this was all about just wanting to help insurance companies on the Republican side.
Well, look, I mean, you don't have to go very far or talk to very many people to realize this isn't about the insurance companies. This is about the American people. The American people don't want this. They don't want a government takeover of health care in this country. They don't want the massive expansion, $2.5 trillion in new spending and new taxes and Medicare cuts and new debt that come with this. This isn't about the insurance companies. This is about the American people. They've made their voices loud and clear, which is why I think you see in the public opinion polls reflecting not only their views about the substance of health care, the process by which it was passed, and the opinions that they hold of members of Congress and members of the leadership of the Democrat majority here in the Congress right now. I think this is very clear.
Senator, I'm almost out of time, but I just want to quickly ask you, there's going to be a lot of positive momentum, a lot of things that people see right away, like your kids are covered till they're 26, the pre-existing conditions benefits that are going to come first. And some people say all of the good stuff is going to come first. The pain in this bill is going to come late, and that's going to be politically difficult for Republicans because people are going to be riding this wave of good feeling, and they're not going to feel the pain until after November. What do you say to that?
I think most Americans, Martha, are really concerned about where the country's headed, about the role of government and what a big power grab this is in Washington, D.C. They are concerned about the debt and what we're piling on future generations. They're concerned about higher taxes on small businesses and what this is going to do to jobs. It is going to kill jobs. And they're concerned about the cost of health care, which at the end of the day is not going to be affected very much by this bill. You're going to see most Americans are going to see their health insurance premiums go up because this bill did not address the underlying drivers of health care costs in this country. It was not reform, it was expansion. And I think the American people don't want that when you've got an economy in recession.
All right. Senator Thune, always good to have you with us. Thank you very much, sir.
Thanks, Martha.